everyone. I hope you must stay safe and stay healthy. So let's start today's fact. Today we are talking about what is an elongated labia. Elongated labia are outer folds of tissue on the vulva that are large enough to hang down and be readily visible. In contrast to the more closed appearance that many people expect of the vulva, there is considerable natural variation in the shape of structures found on vulva, and elongated labia are not particularly unusual, nor are they dangerous or abnormal. Patients can elect to undergo a surgical procedure to shrink them and they become a problem. In the surgery, a plastics specialist will trim the tissue down and reshape it for a less procedure appearance. The labia majora and minora are symmetrical structures on the outside of the vulva that provide some portion for dilated mucous membranes. They also have a number of sensitive nerve endings that can play a role in human aerosol as well as cover the vaginal opening when it is not in use. Patients with enlarged laiba may have enlarged inner and outer labia, or just one set of tissue may be somewhat longer than expected. There appears to be a genetic component in the size of labia, as some ethnic groups are more likely to have protruding labia. Some cultures accommodate this with a practice called labia stretching, where the tissue is encouraged to grow larger and longer. The folds of skin are highly elastic and when stretched gently over time can grow quite large. Once stretched, they will not return to their original size. For some patients, enlarged labia can be a problem. If the tissue is large enough, it may be uncomfortable to wear underwear or pants, and engaging in some physical activities may put stress on the tissue. This could cause groin pain or irritation. The women may have a higher risk of infection, and inflammation in the around of vulva, which can be a cause for concern for sexually active patients. In other cases, patients may experience physically psychological distress. In enlarged labia surgery, a plastic surgeon will meet with the patient to discuss the goals of the procedure and discuss how much tissue to take off. He will carefully trim tissue while leaving nerves intact. The patients may experience pain and inflammation immediately after surgery and may need to take pain management medications as well as anti-inflammatory to stay comfortable. Usually, sexual activity immediately after surgery is not recommended, but once the wound heals fully, the patient can resume normal activities. So that's all for today. Goodbye everyone. Have a good day ahead.